It is important to understand when you are looking at the IBD or when ulcerative colitis and Crohn's disease that there are two things to consider. One is what is your end point when you are treating? So the end point is no longer just your clinical improvement. This was of the past. Like, I'm feeling better now, I don't need the medication anymore. Or the medication I'm taking, it's giving me good health and my symptoms are all gone and I will keep continuing this medication. But what if your disease is actually still going on inside the gut? So the end point now is, we call it endoscopic healing. So if I do your endoscopy and colonoscopy and I see that yes, the lining of the wall is showing improvement, there are no longer ulcers and they are no longer narrowing, then that means that we have achieved our target. But these two are not always occurring simultaneously. You can feel better, but your gut may still be unhealthy and there is still disease activity going on. Or you're still feeling not so well, but when we look at the gut has healed really well. So, but the goal is to get endoscopic healing. Why? Because if there is healing in the gut, that means there is less chances of you needing surgeries in the future and the disease is not getting advanced. So that gives to a better quality of life and long life. Okay, long healthy life. So endoscopic healing is our endpoint in therapy. And also important to remember that IBD can be mild. We divide it into these categories: mild, moderate, and severe. And the therapy depends on these. So if it's moderate to severe, then we go straight to the biologics and small molecule therapies. We are avoiding steroids now because of its numerous side effects. So we are no longer, that was thing of the past. So we're trying to avoid the steroids. We used to use steroids for induction, and then for maintenance we would use other medications. We had certain immune modulators like azathioprine or Imuran. We used those. But once the biologics have shown that if early use of it in moderate to severe prevents future fistula formations and prevent future surgeries and change the course of the disease, the natural history, it changes. So you use biologics early on in moderate to severe. So in mild cases, you can go with the enteral nutrition as we talked about and the dietary changes, Mediterranean diet. You can go with in mild cases, and in mild cases we also use a substance that has aspirin in it, but it is delayed release and it releases itself only in the gut area and does not absorb much into your system like aspirin does. But it has aspirin as part of its, salicylate as part of its ingredient. So we use, they're called mesalamines, and these are used for mild conditions of ulcerative colitis and Crohn's disease. Also important to understand that ulcerative colitis is only restricted to the colon. So in worst cases, if you remove the colon, the condition is gone. But in Crohn's disease, it is hard to improve. Even if it's in the colon, you remove the colon, but Crohn's can occur in other parts of the gut. So Crohn's disease can occur from mouth to anus, anywhere in the gut. Small bowel, large bowel, colon, which is colon, and then stomach, esophagus, mouth. It can occur anywhere. That's why it is hard to treat Crohn's. If you take the colon out, other part still has Crohn's or may develop into Crohn's. So this is what is important to know, that we grade the condition. It's also important to know that IBD itself is a spectrum. It can be many different types now, as we understand. Some are associated with, as we talked before, extraintestinal manifestations, which means your joint pain or joint swelling, which is arthritis. Or you can have skin manifestations, erythema nodosum and pyoderma. You can have those conditions, even psoriasis. And other thing to note is that in the biologic treatment now, sometimes we're using two different types together to attack two different things. For example, it's not only just TNF alpha, but also IL-23. If you attack or contain that part, then two different pathways on biologics give a better result in better containing this condition.